Hello, I'm Vernon Billy, CEO of the California School Boards Association. Since March of this year, we all have been reeling from the impact of the coronavirus on our schools. This pandemic has truly shaken the fabric of our society and upended our entire school system in so many ways. I get it. So before I go any further, I want to commend you for your hard work and commitment you and your school leaders are demonstrating during this unprecedented time. I know it hasn't been easy. Sometimes there may be few obvious answers to the questions you face, but as your association, CSBA is committed to providing you with critical updates and tools that will help you navigate this crisis. You can find all of this information at www.csba.org/coronavirus. That's a special webpage we've built to capture crucial information for schools confronting COVID-19. I encourage you to visit this webpage and take advantage of all the resources on the site. We update this page almost daily, and it can serve as a valuable source of information for you in your fight against COVID-19. In addition, we'll be doing webinars on important topics related to COVID-19 guidance from state and federal officials, as well as topics directly related to your governance responsibilities. These webinars will complement the information that we currently provide on CSBA's Online Learning Center, which also includes curriculum related to the pandemic. We have a lot to offer, but we want to hear from you as well. I encourage you to also use this webpage to share your experiences on how your district or county office is addressing the challenges related to this virus. CSBA will continue to work on your behalf as this crisis unfolds. The vital role your schools play in your communities has never been more apparent. I thank you for your leadership during this tumultuous period and pledge to support you and our students through this challenging period. Thank you again. Be safe and remember to practice good social distancing.
We thank CSBA CEO and Executive Director Vernon M. Billy for those introductory words. And I want to harken back to something that Vernon said during the end of his remarks, which is that never has the role of school districts and governing boards been more apparent or more crucial in ensuring that our students receive what they need. Schools all across California and around the country have been grappling with a huge philosophical, educational, and logistical challenge of how to support students during this unprecedented time of school closure and COVID-19 response. Much of that conversation, understandably, has been focused on academic learning loss, on how to properly implement distance learning, and on the tremendous financial impact of grappling with COVID-19 and preparing to reopen schools safely. Somewhat overlooked in those important discussions has been student physical and especially mental health, and how we can support student mental health during a time when there's not on-campus instruction. This is critical because students, particularly those who are young and developing and even through their adolescent years, thrive on this time of social interaction, personal development, and their ability to commune with and to be around their students, fellow students, peers, and then also trusted staff has suddenly been removed. They're thrust into a great deal of uncertainty, and there's no clear end in sight. Even more extreme, you have students who are living in deep poverty or possibly in abusive households who no longer have access to their traditional coping mechanisms or their regular escapes. They are no longer interacting with mandated reporters, and they don't have the sounding board of trusted friends or adult staff at school. That creates a very large void which needs to be filled. And so today we have a group of panelists who are going to help us address this issue, provide some guidance, and hopefully some solutions that education leaders and governing boards can implement to better serve students. The title of today's presentation is Supporting Student Well-Being from Afar, and we're going to talk about caring for students' mental health at a time of school closure. Next slide, please. Before we get into the heart of the matter, let's deal with some housekeeping details related to how you can fully participate in today's event. You should see on the right-hand side of the screen for most of you a dashboard which you can use to take part in the question and answer session of today's presentation. We're going to hold the Q&A until after all the panelists have presented, but if you want to participate, look at that dashboard, which has a number of dark gray menu bars. Near the bottom of that list of menu bars, you'll see one that says questions. Right before the word questions, there is a triangle which points to the right. Click on that triangle so that it's now facing downward. This will cause a text box to appear. You type your question into the text box the same way as you would an email or a text message you're sending over your cell phone and hit send. Once you do, that will be received behind the scenes by CSBA staff who will collect these questions for presentation at the end of our event. We probably won't be able to answer every question individually, but many of the questions inevitably overlap, and we're going to try and address every subject that's raised during the Q&A. If for some reason time prevents that, we will answer the question directly after today's event via email or by including it in the FAQ section on our COVID-19 website, which you can reach at csba.org/coronavirus. That's csba.org/coronavirus. Now that we have that out of the way, let's introduce our august panel that's assembled here today. We are fortunate to have with us Marlon Morgan, the founder and executive director of Wellness Together School Mental Health. Also from Wellness Together School Mental Health, we have that organization's assistant director, Jeremiah Aha. From the California Department of Education, we have Monica Nepomuceno, an education programs consultant with the CDE. From the Stanford Center for Youth Mental Health and Well-Being, we have its director, Stephen Adelheim. And last but not least, CSBA's own education policy analyst, Mary Briggs. So with no further ado, let's start the presentation. I'll hand it over to you, Jeremiah.
Roy, thank you so much. Thank you to Vernon, as well as to Mary, and all those with the CSBA team that are working hard behind the scenes to hold this important event this month. Marlon and I both are very grateful to be here with you and really just want to equip and empower you as your role as you continue to lead, likely through many challenges in your role today. As Troy said, I'm assistant director here with our team at Wellness Together School Mental Health. And we're a nonprofit organization here in California, based in Sacramento. And our goal, really our work, is focused on increasing timely access to mental health services to students and families across the state by partnering with school districts to place mental health clinicians on campus, or in this case, online using telehealth. And so if we can go to the next slide, please. Just want to do a quick introduction of some links that would be helpful for you on your webinar experience today. Now, the first link on here is on our website. It's wellnesstogether.org/COVID-help. And at that link, you'll find a list of resources that'll be helpful for your role to continue supporting your schools and communities, resources to help students, parents, other educators, or even your own family. There's also resources available in Spanish as well at that link. Again, that's wellnesstogether.org/COVID-help. The second link is something that Marlon's going to be talking about a little bit later on during his portion of the presentation. That's at bit.ly/supporting you, supporting students. And don't worry, this slide's going to be up for a few minutes, so no need to race and find your phone to go to the link. It's going to be on here. But Supporting You, Supporting Students was a 4-part webinar series that we held in partnership with the California Department of Education last month. And we're very grateful to have California Surgeon General Dr. Nadine Burke-Harris with us, as well as Superintendent Thurman, as well as many other great presenters, again, as Marlon will share a little bit later, that can help you in your role, even as a school board member, for other admin, educators, support staff, and supporting students through this challenging time. And lastly, just to bring our attention to the link that may be most relevant for today's webinar event, and that is at bit.ly/CSBA webinar. And at that link, you'll find a list of folders and all the resources that are associated with today's presentation. So some of the documents that Dr. Adelsheim, that Monica and Marlon and I mentioned will be in those folders. So at any time, feel free to access that and Mary's resources as well, bit.ly/CSBA webinar. And so now I'll turn it over to Marlon, as our goal for this time, thank you for your time and attention, is to equip and empower you to continue serving your schools and communities. Marlon?
Thanks, Jeremiah. And thank you to all at CSBA and the CDE for allowing us to be here as you all continue to lead our school districts and our educators through this very difficult and challenging time. So my wife's a special education teacher, and so in recent conversations with her, I've heard that even students who don't necessarily show up for class during the school year, during the regular school year, have been requesting more all class meetings, even though we have some students with turning less assignments in, they are showing up even more. And so they're very dependable to be there because they want to connect with their their peers, and also the caring adults that they know are still there working on caring for them and guiding them through this time. So it's very, very important that we continue to remind them that we're all still here and walk with them through this. We've known for a long time that there's been an incredible need for mental health, effective mental health on school campuses. In fact, let's take a look at the next slide there. We've known that, I'll refer to it as BC or before COVID, we've known that 1 in 5 of our students at any given time was experiencing a significant mental health problem that was impacting their learning or their ability to connect with their peers. And we also knew that certain groups, for example, folks who identified as LGBTQ were nearly 5 times more likely to have attempted suicide in the past 12 months. And so we're going to take a little bit of what we've known from the past and also add some of the stressors of today, and then talk about how to really take a systematic approach at looking at how we can meet some of those needs. We've known that since 2012 that the number of students getting less than 7 hours a night of sleep has risen to nearly 22% just since 2012. We've known that personal screen time for 8 to 16-year-olds has risen sharply to over 6.5 hours of personal screen time a day, only to be eclipsed by the amount of screen time spent by their parents, which is 7 hours and 40 minutes. It's from a great Common Sense Media study. And we've also seen that our teens are getting out less. They're staying home more even before this. And in between 2011 and 2015, we saw a 31% increase in students who are more likely to agree with the statement, "A lot of the time I feel lonely." A lot of this has led to the factors combined leading to less physical activity that we know that impacts mental health as well. And even finally, more substance use and abuse for a generation experiencing soaring rates of depression, anxiety, and suicide. They're now turning to substance use even more, including vaping, to experience short-term relief to painful emotions. In addition, since March, we've also seen the effects on mental health of social distancing. And in a recent survey released by the California Association of School Counselors, it indicated that 32% more students now believe that they are in need of some type of mental health intervention due to COVID stress during this crisis. Some of the words that they used, the more frequent words they used to describe this time, has been anxious, lonely, and overwhelmed. And finally, we've seen magnified some of the inequities in our state, in our country, when it comes to students accessing not only the basic needs, food and shelter, but also the magnifying the digital divide. And we knew before this, a study that came out in 2018 showed that we have about 1.2 million students here in California that already did not have access to internet to work on schoolwork or engage with their schoolwork. So now, how can we help? And we want to talk about some more hopeful strategies as we move forward here, and to ensure that students and educators have access to the basic mental health services that we can provide through schools. Next slide, please. As you can see from the past slide, we are not afraid at all to use acronyms. We love them. And so I'll use yet one more acronym to talk about some of the solutions to responding, how we can respond to those 7 S's that we just mentioned. Some of these are taken from some steps from an article of a colleague of ours. It's a great article by Leora Prusson-Wolf from the MHTTC entitled Creating Trauma-Informed Policies, a Practical Guide for School and Mental Health Leadership. And you can find that in the resources folder that Jeremiah shared earlier. The first A is to get together with your district and the staff in your district to assess what was working before COVID happened, and how students were being provided with the mental health supports that they needed to learn and access the curriculum more effectively, and see what was working. And then the second A after you assess is to adapt. Can you adapt anything that was already effective, that was already working? And if there was nothing, then obviously that's a great time to assess too, because you want to make sure that there's something to adapt. And we'll get to adding in just a moment. But the third A is, once you have assessed, adapted what's already been effective, having to look at what might not be effective or what you might need to cut. That means getting rid of programs and practices that cannot be adapted to the current need and limitations we are facing. So that'd be amending those programs and practices. So you may have to get rid of them. This may also look like reprioritizing or retraining pupil personnel services credentialed staff that you already have on campus to shift their focus from academic guidance, or if it was purely on academic guidance prior to this, shifting their focus over to providing additional mental health supports, as that's what they're trained to do as well. And the fourth A is to add. You may need to add resources and staff in the critical area of student support, even in light of many of us are being asked to make some very deep cuts when it comes to the finances of each of the districts, but this would be an area to prioritize as we move through and heal from a lot of trauma and a lot of grief and loss that we're seeing. The fifth A, very related to the previous one, and it is to avoid. If you can, please, I would implore you, even in a tough budget time, to avoid cutting the only people on campus who are trained in formal mental health training, who have the training it takes. Even if haven't been used that way for a while, they can get retrained very easily, and we're going to give you some strategies for that. It's very inexpensive and accessible, and this includes avoiding cutting school counselors, school psychologists, school social workers, school nurses, and school-based therapists, mental health therapists on school sites. If you can avoid cutting those, you're going to need them, and you may need more. And with that, some ways that we can support teachers, school counselors right away is, you'll see on the slide, supporting teachers affected by trauma at statprogram.org. And that's developed by the National Child Traumatic Stress Network. That's an excellent tool. It's free, online. It can help teachers get healthy if they've been exposed to either primary or secondary trauma through helping students through this time. It only takes 90 minutes. We've had almost all of our therapists here at Wellness Together go through this training. Obviously, they're therapists and not teachers, but each of them had said, this has been very helpful for me in my own process to make sure I'm healing and taking care of myself. Next is supporting students exposed to trauma, or SSET. This is a wonderful tool that can help teachers or school counselors get retrained to help support the students who have experienced trauma, grief, loss. It's an 8-week group series. It's very effective and evidence-based, and so it would be a great free training to ask some of your teachers and or school counselors, school psychologists, all those PPS folks that I mentioned earlier to take a look at. Lastly, you'll see gritx.org. Gritx.org is a website and it's a tool created. There's a partnership between Wellness Together School Mental Health and the University of California, San Francisco to put online some cognitive behavior therapy and also dialectical behavior therapy that students can go through on their own and or with a caring adult who has some training in mental health. That's the way that we're recommending that you use it, is to pair it with a caring adult who has some training in mental health, who can guide them through the interventions and be there when things get difficult. There's all kinds of wonderful resources on there, including a breathing room where you can go and get grounded. There's the ability to build a self-care toolkit. I even as an adult think it's a tremendous resource, so please take a look at it. It's also in Spanish as well, and it's free. So, and finally, as Jeremiah mentioned earlier, the recent 4-part webinar series that Wellness Together partnered with the California Department of Education to put on, that can be accessed at wellnesstogether.org/SYSS. The one thing I want to point out about that series was the first one, and it had information from Dr. Sue Coates and Tom Sopp from the California Association of School Psychologists, and it goes through in a wonderful way, a wonderful and systematic way to check in with each of your students and to do just sort of those quick wellness check-ins with each of your students, and talks about some of the tools that you can use, the conversation starters, and just how to get that started and to do that regularly with students when you can. With that, I'd like to introduce our next speaker, who is a colleague and a friend, Monica Nepomuceno. Monica is an education programs consultant at the California Department of Education. She oversees the Mental Health Services Program, co-chairs the Student Mental Health Policy Work Group, and is the Project Calwell Youth Mental Health First Aid Coordinator and a YMHFA instructor. She represents the voice of K-12 students on several committees, including California Behavioral Health Planning Council. Her role at the CDE helps foster connections and leverage resources to engage traditional and non-traditional partners for schools and students. Monica has also been instrumental in forming the statewide suicide postvention response team. Please welcome Monica Nepomuceno.
My goodness, I'm busy, aren't I? Marlon, I'm truly humbled by your introduction. You definitely are too kind, and I'm very grateful to be on a panel today with such amazing advocates and such knowledgeable people. I want to thank Mary and her team for the invitation, and just want to welcome you on behalf of the California Department of Education, and really want to honor you for all of the work that you're doing to continue to serve our students in the most seamless way possible, and especially for being here today to address the mental health needs of not only the students, but also the staff. So I'm just going to be providing a bird's eye view of what the CDE is doing to address both student and staff wellness. The services and the support that the CDE is providing are very critical in helping those LEAs that need guidance and that are struggling. But I wanted to start off with sharing a metaphor that you might have recently heard about, how we're all experiencing the same pandemic, but we're not all having the same experience. So it's the metaphor that says that we're not all in the same boat, right? Some of us are taking this time to reinvigorate, and our lives really have not been that disturbed. So we're sort of cruising along in a yacht, finding that time to not only recharge but also reconnect. And then there's other people who are on a sailboat that they're feeling a little bit of more of the rough waves, right? While others are still in more of a smaller vessel, like a fishing boat, and maybe that fishing boat has a hole in it. And so there's also the others that are not in a vessel at all, and they're just treading water, trying to stay afloat and trying to survive. So we're definitely not in the same boat, given all of the challenges with finances, support systems, workload, resources, etc., including our physical and mental health, but we are definitely in the same water. And so we have to take this opportunity to really see things from different perspectives, because not everybody is able to have the technology or the support to continue to work smoothly, right? And it's not just affecting our students, but also our staff that are having these mixed experiences. And so as we continue through this COVID journey, I just want all of us to remember that we're dealing with this situation from different perspectives and with different resources, and that it's critically important for us to be kind and gentle, not only with others, but with ourselves as well. I think that's what's going to carry us through. And to remember that working at home is not the same thing as working through a pandemic with tons and tons of worries about the uncertainty of what things are going to be like in the future, right? COVID-19, as folks have said before, has really led to an increased stress level across the board. And we recognize the toll that it's brought on to you as leaders and to your school communities. So I want to also thank Troy for highlighting the need to address student needs that are far beyond the academic responsibilities we have. And so if we just take a step back and look at the pandemic as an opportunity to renew our vision for student and staff wellness, that it's not just about academics, right? And take this as a truly determining time where we can change our business as usual and bring education to the 21st century, right? Let's start really, and I've said this before, and Marlon also referenced it, right? Engaging our youth, asking them directly about their needs. We are now finding out some of their needs directly. And so, having the ability to ask them and listen to their answers, because we can assume that we know what their needs are, but hearing directly from them carries such value. So asking them things like, what's stressing you out right now? What are you most concerned about? What do you need to help alleviate some of these worries? What's working for you? What's not working for you? And so as Marlon indicated, this work is already starting to be done. The Youth Liberty Squad, which is a group of California students that's supported by CASC and about 30 other organizations, completed a survey asking over 650 students about their needs. And their results are not surprising, but they are, definitely tell us that there's a dire need to increase mental health services and supports for them. So we also want to hear, directly from those that are on the front lines, and we want to know, from teachers and staff members also what their concerns are, what's stressing them out, what can we do to help alleviate their worries. So next slide, please. So right now, I'm just going to give a bird's eye view of what we have going on in the CDE in the mental health services program and sort of beyond. I want to start off with the Student Mental Health Policy Work Group. And as you can see by all the different logos, we have many partners, many very active advocates, right? And if you can see right in the middle of the slide is CSBA. And it's no coincidence that the slide that was formatted to have CSBA logo in the middle, right? I see it that it's a sign that we need to have a representative on our SMHPW from CSBA to help us learn from their perspective and see things from their perspective. So just a quick overview of the SMHPW. It was first convened in 2012 by then Superintendent of Public Instruction, Tom Torlikson, and really the gist of it is to assess the mental health needs and the mental health landscape of California and gather evidence that support any policy recommendations that we make to the SSPI. Just another tidbit, the work group was originally convened with funding from CalMesa, and in 2016 that funding ended, and then the group realized that we had really formed a cohesive, strong body, that when the funding disappeared, members still chose to continue meeting without any type of reimbursement for their travel. And we have people coming from all different places of the state. So this is a group that's well invested, a group of all volunteer, unpaid people coming from the teaching profession, school counselors, social workers, psychologists, nurses, administrators, and state and county mental health professionals, as well as community-based organizations. And so really, like I said, the mission of the SMHPW is twofold, and it's to build the capacity of California student mental health in kinder through 12th grade education, and also to propose the to make recommendations to the SSPI. Right now, we will be meeting this Friday. We're going to be working on drafting policy recommendations that will address the mental health needs that have surfaced as a result of COVID-19. Some of the policy recommendations, I won't go through all of them, but one of the legacy ones that we're really proud of is the recommendation that included the mental health curriculum into the administrative credentialing standards. So now anybody that goes through the admin credentialing program is going to receive mental health training, or at least a course, right? We tried to do the same thing for the teacher credentialing standards. However, we were not successful in doing so, and we hope that when the standards come back to be reviewed, that we'll be able to do it then. We also have 6 policy recommendations that are currently in the approval process. I won't go through all of those, but if you are interested, I can share with you. I can share those with you later on. Next slide, please. So legislatively, here is what's happening in California. So if you look to the left of the slide, these laws are here to support our endeavors really as we navigate through COVID-19. So for example, right now it's more important now than ever for LEAs to review their suicide prevention policies that resulted from AB 2246 and then recently AB 1767, to make sure that those policies include language about remote check-ins with students and telehealth supports for students that are having or have been identified as having suicidal ideation. I won't go through all of that, each of these, but I'm going to highlight also SB 972, which requires middle and high schools that distribute ID cards to include the National Lifeline prevention number on the back of their cards. Hopefully schools are doing that and including, some, not just the number, but also an explanation, or also just some wording that students understand why that number is being included on the back of those cards. And I would also recommend that as you are going into this new year, that you not only write the number on the back of the student ID cards, but also on the back of the staff ID cards as well, because we see that there's an increase in suicidal ideation among school staff. If we look at the right side of this, I'll go a little bit into the CARES Act, right? The Coronavirus Aid Relief and Economic Securities Act, which provides approximately $31 billion in emergency education funding to students, schools, institutions, and states across the country. So it gives states $13 billion to support school districts, and this funding is used to cover a wide range of activities, including technology and training, and also for emergency foods, housing, and other basic essentials, which can also be used for mental health services. It also provides $3 billion to governors for emergency education relief that can be spent on school districts. Within that, the governor has appropriated $4.4 billion from the CARES Act to public education to address SEL challenges and trauma, and it really does give the districts the flexibility on how to best use these funds. But hopefully, you know, these funds can be used for maintaining mental health staff or supports. Much like Marlon indicated earlier, we must do everything possible to keep these critical positions that support students. If the students are not well, they're not going to learn, and our academic endeavors really are going to be futile. A little bit more on the CARES Act. The new law does relax the requirement that coverage be restricted to real-time audio-visual technology, which really opens the door to coverage for phone-based and remote services. It gives states greater flexibility with regard to Medicaid coverage to enable providers to conduct initial assessments in the phone call. And it also relaxes the requirement that a care provider must have seen a patient within the past 3 years so that they can receive this remote service. So that is no longer relevant. So if we look at the governor's budget, as I said, $4.4 billion is from the CARES Act is going to be used to address SEL and trauma. $1.6 billion in ESSA federal emergency relief is in the governor's proposed budget, and $100 million of these funds are going to be awarded to county offices of education to develop networks of community schools and coordinating health and mental health and social services for those students who have high needs. The last thing is that $63.2 million is going to be used for training and professional development for staff members to address trauma-related health and mental health barriers to learning. Next slide, please. So just to end our resources that we are currently offering through Project CalWell, the Youth Mental Health First Aid Training, which is typically done in person, but we are now going to be offering it through the virtual platform, and it is 4 hours of self-directed, self-paced training with another 4 hours with an instructor through Zoom. And we have Living Work Start, which is came out of AB 1808 and requires the CDE to come up and identify an evidence-based online suicide prevention program. So we will be launching Living Work Start very soon, within the next week or so. We just were on a webinar notifying the County Office of Education leads how to distribute the licenses and access through in their areas. We also have a guide to increase mental health services for students, which is an FAQ document. It really is to help LEAs and other administrators to assist schools and districts to build capacity that are going to better address the mental health challenges among students. So this guide sort of tells you, what the difference is between the different mental health professionals, what their capacities are, and what the board of, oh my gosh, now I just forgot that, but whatever the BBS is tasked them to do, right? Also, I didn't include a graphic or link that is still, because it's still being approved internally at CDE, but I would be remiss if I didn't mention the statewide suicide postvention response team that was mentioned a little bit earlier. It's part of our SMHPW, and the goal really is to offer support and guide LEAs through a difficult and confusing period of when they experience a youth or staff suicide. The team is going to serve as a support with whom LEAs can talk about, the processes of postvention. The team's going to ensure that LEAs are receiving not only accurate, but also timely information, that they'll be able to identify resources to fill in any gaps that are identified by the team. They'll assist with messaging to staff, parents, students, and the media, and then help find ways that to support those that have been affected by the suicide. So, additionally, we want the LEAs to also build their capacity by providing them this support. So with that, I know that Dr. Adelsheim is going to be talking about the importance of addressing youth suicide ideation, and I will introduce him now. So I'm going to read a little bio here. Dr. Steve Adelsheim from Stanford University is a child and adolescent and adult psychiatrist who works to support community behavioral health partnerships locally, regionally, at the state level, and nationally. He's the director of the Stanford Center for Youth, Mental Health, and Wellbeing in the Department of Psychiatry. And for many years, Dr. Adelsheim has been developing and implementing early detection intervention programs for young people in school-based and primary care settings, including programs for depression, anxiety, symptoms of psychosis, and first episodes of psychosis. So with that, welcome Dr. Adelsheim. Thank you.
Thank you. Thank you, Monica, so much. And thank you to the CSBA for allowing me to participate in this very important webinar this afternoon. And really thank you as members for choosing to spend your time focusing on the mental health needs of the students that you're supporting through your role as school board members. As Monica said, I'm a child psychiatrist by training. I've been working in school mental health now for, I realized, over 30 years. And right now is a really unique time in terms of this work. The center that I work at has been focused not only on expanded school mental health supports, but also on finding other ways to link to schools, to be able to bring supports to young people really with an early intervention focus. And so I'm going to talk a little bit about what the young people are telling us, as Monica said, that they're looking for and some of the concerns they have right now, then share with you a little bit about some of the work that's happening around the state that we want to be sure we can link to strong school mental health efforts, and then also be able to talk a little bit about the importance of your role as school board members, believe it or not, in terms of addressing suicide prevention and postvention, because your role is actually very important. So if I could have the next slide, please. As Monica said, it's been really important to reach out to the students and the young people in our communities to find out what actually their concerns are. So I just want to take a minute to share a few of them with you. As we've been working with young people in communities around the local area and the state, one of the things that young people are telling us is people are really trying to find ways to support us, to tell us what to do, to tell us how to build structure, find ways of otherwise making connection. But one of the things that seems important that our young people are saying first is we really need people to understand how we are doing and how we're feeling, as Monica had shared. And what they need right now, it seems, is validation of what they've lost in terms of their connections to each other, in terms of the ability to have a graduation ceremony or a prom or those kinds of special events at school. Our young people have lost the capacity to have those informal conversations in the hallway and check in with someone, whether it's in the cafeteria or through a sporting event or other activities. And all of the communication that they're having, just like ours, as other adults, is much more intentional. And the informality is harder, and really our communication really requires a direct intent in a way that young people aren't used to or haven't had to do as directly before. So it's a big change for them. And as much as young people are getting more comfortable with learning how to reach out in more formal ways, the rules around communication have changed. And we're looking at Zoom things and Zoom classrooms and other related ways of going to school that on the one hand are working well, but on the other hand, we're continuing to see our whole system struggle with in terms of how to do them appropriately. So one of the things that seems important is to allow our young people to have the opportunity to feel bad, to acknowledge what they're missing out, to acknowledge how hard it is to say goodbye, and then to acknowledge the uncertainty of what comes next as we're trying to figure out next steps in terms of physical school, classrooms, for young people that might be leaving school and getting ready to go on to the next step, whether it's in academics or whether it's through employment. There's a great deal of uncertainty, and it's a really hard time for our young people. And it's important for us to find ways to support them as they struggle with these changes and really acknowledge them. And one way we actually can do that is by acknowledging our own struggles around this too, and allowing ourselves to be human and honest and open about how these changes are affecting us as well. If I go to the next slide, please. As I mentioned, we are really focused at our center and also around the state and with our partners here today on this notion of building public mental health supports for our young people. And these really begin with school health and school mental health, which is where our young people are. And as was being suggested by Marlon and others, even now, and more so now, the importance of school health and mental health supports for our young people are even more critical. And as people talk about this whole pandemic, there's a great deal of discussion about the second wave being a mental health wave and the need to ensure that we have critical supports for our young people, for their families going forward. So as was said earlier, this is not the time to make the cuts to those services, but the time when one might really look at increasing them. As mentioned before, there's an effort to build more dollars for telehealth support as it relates to behavioral health. There's also actually legislation from the Children's Hospital Association that's looking at trying to build models of support where the children's hospitals can link to schools and link to school health and mental health providers to provide backup consultation and expertise to reach across the state, that could also specifically reach out to rural communities, tribal and indigenous communities around the state to support the capacity of school health and mental health professionals to be able to reach young people effectively. At our center, one of the things we're working on are creating these integrated youth mental health programs, which are one-stop shop clinical programs for 12 to 25-year-old young people. We're calling them ALCOVE, based on the guidance of the young people in our communities. We want to create these programs for early mental health support, primary care, support education, employment, early addiction treatment, and critical peer support, all developed with a youth voice and youth direction to serve as very important linkages for school health and mental health supports for our young people. As you see that we're also looking at even early psychosis programs, because we know that even with the risk of people losing touch with reality and becoming confused, early intervention, even in those situations, is critical and can have a profoundly positive effect on stopping symptoms in their tracks, delaying and maybe even preventing movement to more serious psychiatric conditions. So one of the things that we're all working on together is how to build this continuum support for our young people, since we know that half of all mental health conditions are starting by the age of 14, and our young people really need to be able to access that mental health support in an equal way to other medical support as well. Next slide, please. So as we mentioned earlier, this is also a time where we're seeing really not only nationally, but internationally, increasing risks around suicide. And I will tell you that before coming to Stanford almost 7 years ago, I was the director of school mental health programs in the state of New Mexico, which is one of the states that has one of the highest youth suicide rates in the country. And in moving actually to Palo Alto, which then had its second youth suicide cluster while I was living there as a community member with a daughter at Gunn High School, which was known and is still known as the suicide high school to many people. This has been an important concern for me, certainly personally, but also professionally as well. So when we're looking at suicide risk right now, it's much more complicated because school isn't open. And at the same time, we have young people who are getting increasingly depressed and anxious, as well as isolated, as was shared in the school counselor report. And rather than seeing 1 in 5 young people really having a mental health issue, we're hearing young people saying half of them are needing additional support. And young people are at home and families dealing with greater economic distress right now, in close quarters without the ability to be out with friends as much. We're seeing increasing firearm sales, which is always a risk factor for increasing suicide, and expanded media reporting about the anxiety, the distress, and the struggles, often without the supports available as well. So there are things we need to be doing to minimize this risk right now, and things that could be happening at your schools. And frankly, they are happening at your schools, but we need to highlight them and ensure they're allowed to continue. So we need to ensure that social and community connection can happen for our young people, and maybe they aren't as focused on their academics at a moment, but having the opportunity to connect with each other through the internet or through other means of connection become even more critical. The telehealth care is an urgent and critical piece as well. And also being able to show stories of resilience and hope and provide additional resources is now more important than ever. When we're looking at cases of youth suicide, which we've seen within some school districts around the state over the past few months, we again still need to look at ways of having that initial check-in with vulnerable young people and making sure that we can build the connections to them and make sure that we're checking in with them. And these are young people who may have been exposed to suicide before, who are dealing with other mental health challenges, who are struggling with where to live, have a trauma history. And as was mentioned before, the LGBTQ+ community is a group that needs particular support and is at increasing risk as well. For you as a school board member, what does this mean? Well, one of the things that we're really clear about is that the media have a big impact on increasing or decreasing risk of second suicides and what we call suicide contagion. And so what's very important is that the media, when they talk about these situations, and for you as a school board member and as a leader of your school district, that you take a leadership step in addressing the media and helping them learn how to address these issues in a positive and appropriate way. There are clear guidelines that are available online and as a resource to you about what the media should say and what they shouldn't say at the time of a loss due to suicide, including the specific language that's used, not mentioning the means of the suicide, not putting the situation on the front page of the paper, but ways of talking about suicide that describe things in a multifactorial way, and looking at ways of then having stories of resilience and support, as well as information on where to get additional support if one is feeling at risk for suicide. For school boards, what this means is ensuring there's a single point of contact for media communication, whether it is the superintendent in partnership with school board leadership and the principal of the affected schools, and having ways to ensure that everyone in the system is aware of where those questions from the media should go. In addition, the bullet points and the messaging need to be developed really as a team to be sure that they meet the media guidelines and that everyone is in agreement on how to move forward. And these interventions and these supports that have an important aspect of coming from school board leadership will really go a long way to decreasing risk of additional young people dying by suicide if a district and if a community is unfortunate enough to be having to deal with that situation. So at this point, I'm going to turn things over to Mary Briggs, who's going to talk about how you as a trustee can better be supporting your students within your districts. Thank you, Mary.
Thank you, Stephen. So just another moment to say thank you to all of the experts that we've had on our panel today. As you can see, there have been many excellent resources that have been developed or that have been highlighted today that can help you as a trustee address the issues that students are facing during this pandemic. But it was really important to us at CSBA to offer additional thoughts specific to your particular role as a school district or county board member. Next slide, please. So as you know, trustees play a unique role in supporting students. First, your board is responsible for setting the mission and vision for your LEA. Remember, there's an extensive body of research that indicates that for students to be able to learn effectively, their core needs must be met. Trauma does have an impact on the brain's ability to learn new material and retain it. So mental health support is not an extra. It's a foundational element that helps ensure students learn and thrive. And for this reason, one of your central missions is to ensure that all students have access to supports for their mental health, especially at a time like this when the challenges are even more than what we've traditionally experienced. That means that local COVID responses must include finding ways to support students' emotional well-being, even in these challenging fiscal times. Second, you set policy. Now is a good time for you to do a review of current policies and determine if new or updated ones are warranted. Just a little bookmark for you. I want to flag that CSBA is in the process of preparing a comprehensive pandemic policy that will be available to you in early June. It will address some of the mental health components, but we want to make sure that it's something that you're keeping an eye out for. And finally, and the most challenging perhaps responsibility you have in this moment, you as trustees help decide how to allocate resources. We know we didn't have enough resources to support all the students who needed mental health services prior to the pandemic. And now the increase is in the middle of a funding crisis presents a unique challenge. That means you'll need to be strategic. That includes thinking about how your LEA might shift resources to increase access to mental health supports, as well as thinking about ways to access additional resources, perhaps through partnerships. I'd recommend that these discussions include those who have been providing services to students, as well as the students themselves and their families, as they can tell you what challenges may need to be addressed before the new year begins, including as well as what practices have been successful during the campus closures. You know, this is a new circumstance for all of us. So this end of the year and summer present an opportunity for us to learn from what has happened this spring in planning for the fall. Finally, there's one additional way you can use your role as a trustee to support students: how you use your questions in meetings to guide the conversation at the local level. Next slide, please. One of the ways that you as a trustee can shape the direction of work in your LEA is by asking questions that dig deeper into the issues, because we know that to make good decisions, you need good information. In the case of COVID-19, that means asking questions about current practices during distance learning and asking questions that can shape decisions for the coming year. While this year is almost over, you have a moment now to pause and try to understand what needs have surfaced during the campus closures and what lessons your LEA has learned from their experiences with emergency distance learning. Those answers can help shape plans for the fall, so you can begin moving resources into place for students, whether it's through distance learning, a hybrid model, or in person. To help, CSBA developed a handout of sample questions that is designed specifically for you, trustees, to ask as you're thinking about this. So questions about assessing what services are being provided currently during campus closures, how you're even identifying what needs students are encountering in this moment, and kinds of questions that you might ask as you're planning for the fall. This is available on CSBA's COVID page. It should be available as no later than Friday, but I did find out today that if you receive a survey at the end of the day about this webinar, it actually will include a copy of this handout for you. So open that link to the survey. You'll have this sooner than anyone else. These examples are questions that you can tailor to your local context, and we hope that you'll find them useful in conversations about understanding the current issues and as you look ahead to the next year. With that, we're going to open this webinar to any of the questions that you may have. So Troy, I'll hand it over to you.
Thank you, Mary, and thanks to all our panelists for a very illuminating discussion of some of the issues and challenges that schools are grappling with as they try to support students' mental health from afar. I know that some people who are here are eager to get into the Q&A section so they can have their specific queries addressed, and I don't want to waste any more time, so let's hop into that. Again, if you haven't submitted a question yet, you can do so using the dashboard. But for those who already have a question on file, just want to get into that quickly. The first question relates to different modes of communication with students. We touched on this during the presentation, but I think it's important to isolate this. Jeremiah or Marlon, will you talk about some of the methods that schools are using to communicate with students since they don't have the opportunity for in-person interaction?
Sure, I'll mention a few that we've seen used fairly effectively. I know that we use the Zoom platform, and it's important, obviously, to make sure that you have a business associate agreement and that it's secure. You know, a lot of platforms have different models or modes that you can select, and sometimes the more secure ones can cost a little bit more. I do think Google Apps for Schools has some FERPA guidelines already in there. So for using Google Hangouts can be great. Also communicating telephonically, we've seen people be able to use the telephone, and also we've even heard of a few teachers being able to go and deliver some of the meals. Not that anyone should be expected to do something like that, but it's been very uplifting even just to hear the stories of sometimes teachers going and delivering meals outdoors and staying outdoors and delivering some of that food.
Great, thank you, Marlon. The next question relates to the legal and the judicial system. The viewer wants to know that since visitors are not currently allowed in juvenile hall, how do schools and educators meet the particular mental health needs of students who are in the court system? And if there's no easy answer, we can simply say that.
Yeah, this is Monica. I think that's an excellent question and one that we have not navigated yet. So we will do our best to put our heads together with this team to figure out, you know, I'll go back to the CDE and figure out what we're doing. That is not part of my program, but I do have colleagues that are working in those programs. So I'll go back and get an answer for you guys.
Thank you, Monica. The next question pertains to a particular breath-based stress management technique offered online for educators, parents, and children. I don't want to do any advertising for a particular outlet, but is our panel familiar with breath-based stress management techniques?
Yeah, there's some great ones that are free on gridx.org. and that would be something to advertise since it's paid for by a grant and can be accessible to anyone with access to the internet. And if you click on Breathing Room in gridx.org, you'll be able to learn some of those techniques right away, and it sort of walks you through. I think that's great. So again, that's gridx.org through the University of California, San Francisco, and it's really meant for 12 to 26-year-olds, but also is certainly helpful for adults as well. There are a few others, good alternatives, and I think even something like, try not to do any marketing, but I really have appreciated what Mindful Schools has done in the past in the Bay Area, and they've done a great job by teaching and informing educators of how to lead students through some of those exercises.
Great. The next viewer wonders how we can better communicate and work together with other agencies such as CPS, police, etc.
If your area doesn't already have a group that comes together and meets monthly and brings together some of these stakeholders, I would say, to start that regular time where you all meet together and talk about the needs that you're seeing in the community for the students and families you serve. That kind of communication is going to be very important, especially as we move forward through all of this. So I know there are a lot of areas where that's already happening, and there's, I know in Alameda County, we've seen some really great models with their cost team model, the continuum of care that they have there, and that meets with the county and a number of other stakeholders. So that might be a good place to look. We can put some resources on the drive as to how that works as well.
And if I could just follow up on that, for a second, I guess I really have the sense that particularly in these challenging financial times, it's going to be really important for school districts not to feel like they need to be addressing all of these needs of these young students and families on their own. And at the same time, we don't want to be duplicating efforts that are happening with other agencies and other partners in the community. So as Marlon's really suggesting, this is really a most critical time for ensuring that communication is happening in coordination between school districts, county offices of ed, and all of those other partners to ensure that there's non-duplication of service, there's efficient use of dollars, to be sure that our young people are getting the supports that they need in a way that really can link them to all the appropriate services in a supportive way. So as Marlon was saying, if it's not happening now, this is a time to ensure that the schools that you're working with are building those connections, at least virtually. This is the moment where we really need to see those connections happen.
That raises two things. Oh, sorry, Monica, do you want to go ahead?
But I just wanted to add something to that, because there are a couple of programs out there, they're very similar and they cost nothing. It's the Focus, or Focusing on Students or Children Under Stress, and it's similar to the Handle with Care program that was actually implemented first in the East Coast, and that is a partnership between schools and first responders. And I think right now it's a critical time because students are not in school, and so most of the time how this program works is when students are in school and a first responder happened to have been at a child's home the night before. We don't know, we don't care about the details, but we just know that that child may have experienced some kind of trauma, that there's a little note or some kind of, form of communication that says, handle with care. Jeremiah, we were at Jeremiah's home last night, and that's all you need to know. Just make sure you give this student some extra TLC. This right now, this type of collaboration and communication is critical right now, because when we're at school, we can see some of the signs, we can hear, we will receive that slip, but right now I don't know how that program is being handled, and also how do you find out for those LEAs that don't have that program, how do you find out if a student has experienced some kind of trauma because they were parent was arrested, or it's just a myriad of different things. But so those are two programs that cost nothing and just take collaboration and a little bit of coordination, but that have excellent results.
And I think that all of those are great ideas. One thing that I'm hearing from some of our member districts as they are beginning to think about next year, if they hadn't had a group in place, there have been a few districts, such as Arcadia, that have actually convened a group of mental health experts, children's mental health experts, to think about what kinds of pieces of support to put into place. And so not duplicating those efforts is really important, but actually the discussions that we're having about reopening, this is a really unique opportunity for us to think about it and put something like that into place. And I would just advocate, in addition to interagency members, to have community members, including families, in that kind of conversation as well.
Great. That was really rich discussion. I definitely appreciated that, and I assume our viewers will as well. The next question talks about the important role that teachers play in supporting students, something that was just touched on. And the person who asked the question wants to know, how can we support teachers' participation in helping students with mental health during their online teaching time? And is that even a fair request to make of teachers who are under a lot of stress and pressure at this time?
I think if I'm a teacher who has several students and trying to meet with all of them and also provide their academic needs, I may try to partner up with one of those folks on campus who used to do this before COVID, and that can include school counselors, school nurses, psych, social workers, therapists. Really need to work together as a team. Probably want to have some type of response to intervention type meeting weekly to talk about students you're concerned about and who can help best and when. Those usually happen during the school year, but to ensure that they're happening now so that teachers can have a group to refer student names to and student concerns to, that you want to work as a team.
And I think I would add, part of the concern also is, how do we support our teachers well enough so that they can really be in a position to support our students and families? And I think some of us have been involved in, Marlon and Jeremiah earlier mentioned the Mental Health Technology Transfer Center, that is part of our region in terms of school mental health support. And they have been doing these Wednesday webinars focused on wellness. And the response has really been overwhelming as we've looked at the needs of teachers and others working in schools to figure out how to take care of themselves, while they're also taking care of maybe their family members at home, while they're also working, on an intense basis supporting all the students. And so I think part of the issue becomes, how do we allow teachers to be people in the context of all of this and acknowledge the complexity of their lives while they're supporting students, and ensure that we have opportunities for support and wellness for our teachers so that they can be more effective in supporting our young people and families as well.
Dr. Adelsheim, I would agree with that. And just to add, I think a tool to be helpful for this is what Marlon, you mentioned in your presentation, statprogram.org, the supporting teachers affected by trauma. For those that are going through it, just that might be taking care of a loved one or someone that's close to them, or walking with a student through some traumatic experiences. And that takes its toll. Caring has a cost. And there's a lot of helpers that are viewing right now, a lot of helpers here in the panel right now, and oftentimes we can neglect taking care of our own needs, especially at a time when personal and professional boundaries have kind of blurred, right? Our living rooms or our kitchen table is now the conference room, or where we're meeting with students or families or admin. And so even more important to have these kinds of resources from the NCTSN, statprogram.org can be something great. And just 90 minutes and it's free to really begin to help educators take care of themselves during this time.
And even too, just in a very simple way, remembering that teaching even before this can be very isolating. You often spend time all day long with, there's a huge age differential. You're not really with your peers or your colleagues very much. And so now, even more than before, it's important to make sure you're having regular meetings with your departments, or even, I know that I've come home a few times and my wife's been on a happy hour that starts at 4 p.m. for teachers. That's an hour long, and they connect and can really support each other during that time, even just seeing each other's faces and talking about some of the same things and debriefing about the week. They can support each other. Teachers really do a great job of supporting each other, and sometimes that takes being a little bit vulnerable or stepping out and just kind of calling it and saying, hey, how have you been? Do you mind if I tell you some challenges I've been facing, and really connecting with each other?
I would just add that I'm glad that you mentioned that, Marlon, is, having support from your colleagues is critically important. But the other thing that I would add is that administrators need to check in with their teachers and ask them those questions that I said in my presentation. How are you doing? What do you need? What's your top concerns? What can I do to help? What support services do you need to make it a little bit easier for yourself? The San Diego County Office of Education and CDE, my mental health program, we're working on a presentation to do just that, to help administrators and guide them on how to reach out and check in with their students. So hopefully we can bring that training to CSBA members so that they can also share with their administrators. But just, remembering that, as Dr. Adelsheim said, we're all human, right? And that we might have babies crawling on us, or like with me, my 15-year-old daughter right now who took the AP English exam and was like, I can't believe they only gave us 40 minutes to write, so she's kind of not having she's having a moment, right? And so I have to tend to that while I'm thinking, I got to run back over here and prepare for this. So we're all human, and teachers are going through that as well. And so remembering that and coming from a place of understanding and giving grace and realizing that people are not going to be at their 100% all of the time. So that's all I wanted to add.
I think our panelists have named some really the most important parts, the big pieces. But I think there are two other things that I'm seeing that are important details to think about if you're talking about supporting your teachers that we sometimes take for granted. One of them is, have we clearly communicated to all of our educators where they should reach out to if they have a student that they think is in crisis? Do they know who they're supposed to be talking to? Do they know what they should do if they have a student that they're concerned about their welfare, or that they might need additional emotional assistance? Maybe they didn't need it prior to COVID-19, but something's emerging. Do they know who to talk to? Who might be able to help them? Making that line of communication really clear is helpful, so that we're not asking them to kind of navigate all of that on top of everything else. I think a second thing, and it's a small piece, but I'm seeing this as a parent and that I appreciate as a former teacher myself, is being mindful about the ways that you're using your online platforms. So for instance, you have times that you might have synchronous learning when students are on together live versus recordings or independent work. I've seen a lot of districts be very intentional about using that live synchronous interaction time for relationship building, community activities, to really provide students those social emotional connections that they may be lacking in person, and maximizing that kind of synchronous time to get that piece that they might be missing from that on-campus presence.
Wow, a lot of valuable information there. I can tell that everyone is really concerned for the students, but also for the teachers who are in a precarious position as well, and trying to support them in doing this important work. Someone wants to know, how do you decide when to refer out for supports in this current situation where you don't have the full range of means to assess the situation?
I think I would let Dr. Adelsheim start with that since.
Well, my first thought in listening to the question is really, to be honest, having a low threshold for doing that at this point in time. I think right now, as we've all shared earlier, it's even more difficult to have a sense for how a student is doing without the capacity to often check in as easily with them in the hallway, to talk to them after a class, to talk to their families. Sometimes access is getting more difficult. And so when we see issues of young people maybe appearing even difficult to reach or more isolated, or some of the things we see around appearing sadder, and sometimes it's important to be able to ask questions about, how are things going at home? How are you feeling? How are you sleeping? How's your appetite? How are you doing? And what's hard is finding the moments to do that. I mean, right now, as much as it's difficult to get mental health access, frankly, by virtue broadly of having better access to telehealth than we actually have in quite a while, there might be more opportunities to link young people and families directly to more support. So right now, given the increasing isolation, given the uncertainty we're all feeling without being able to have a sense often of how things are going at home, I think if we have really any concerns at all, within a couple of questions, I think we should be going back to family members, checking in with them, getting a sense from families about how things are going. And if they're not having a sense, it's important to then be able to share as appropriate what concerns you're seeing so that we can help those families link that young person to at least an additional in-depth assessment, whether it's through another school mental health professional or someone else in the community.
And I would just add that, we really, I agree, we need to lower that threshold and make sure that we are referring those students that we see some signs, but there's also other students that we, cover it pretty well. And so there's a couple of suggestions. I think one of my teacher friends, what he's doing is he's sending out on Zoom or Google Classroom, he's just sending out certain prompts, like he's saying, this is Mr. Vega. I'm, shouting out to you. Tell me how you're doing. I don't care how long or how short you want to make it, but just let me know how you're doing. And so that kind of starts the conversation. And while I agree that we want to connect students and families to support systems, I also know that sometimes kids just want to know that they're missed. Kids just want to know that they're cared about, that the people that were taking care of them at school are still wanting to take care of them while they're at home. And so that's critically important, right? There's a significant number of students who are unaccounted for. And so we need to do everything possible to make sure that we have some kind of contact to make sure that they're okay. And so I'll give you an example. We've been working with Natomas Unified, and they have about 16,000 students. And so they had their staff members check in with, most of the students. And I think that they had about 20 that they couldn't get a hold of. And so, they had a bright idea of, hey, some of the students that we are not hearing from have these Chromebooks. And so the Chromebooks have GPS. And so let's figure out where they are. So there they go, knocking on the door, hey, they weren't at their particular address because those students were starting to move around. So they go even to the next city or to the next county to find out where that student is. And they said, we don't want the Chromebook back. We just wanted to make sure that you're safe. So, taking that extra step and developing a plan to check on those students that we have had no contact with, that's critically important.
Thank you for that. Another important question around relating to students and families where English is not necessarily the first language. A viewer asked, how do you provide wellness and mental health services to Spanish-speaking families? And I would extend that question to any family that speaks a language apart from English in the home. How do we best serve students and families in that situation? Marlon, do you have thoughts on that?
Yeah, I think I remember the last high school I worked at back when I was a school counselor, we had almost 40 languages spoken at that one school. And so we used all types of tools to communicate with families that had a different home language than English. And one of them, was a language line, or there's all kinds of new, apps and things that can translate into other languages. As far as providing mental health, I think to make sure that if you're going to do that, or if you're going to provide actual mental health therapy to students and families who English may not be their first language, please make sure that you have translated all the documents, including informed consent and maybe some information about the therapy into their home language so they can have a full understanding of what they'd be participating in. I think in addition, one sort of silver lining that I could see maybe happening from, and that we've experienced at Wellness Together, is we have really a lot more therapists who are bilingual, at least English and Spanish speaking, in the San Diego area. And now we have the ability to, we used to be on campus, now we're all online. And so now those therapists can now work with folks up here in Sacramento who may speak Spanish only. And so they're able to get those services. So with going online in a huge state like California, I would encourage you, if you have maybe two counties away, there's a provider who may have some bilingual staff, whether it's Spanish or Russian or another language that would be helpful for you, to try to reach out in your community and see if they can provide those services now online, even if there's a distance issue that can work for you as well when it comes to equity. As long as obviously that the student has access to the hardware and the internet, which is another equity issue that should also be taken into account.
Okay, thank you. One person talks about how teens view mental health and getting treatment, and notes that some teens have reported issues with a stigma that has prevented them from having discussions about mental health. Is that something that's changing? And do we anticipate our current situation with virtual consultations impacting that at all?
I think to start out, I'm sure Monica has quite a few thoughts, but to start out, there's been some great programs that have happened, even as Marlon said, BC before C19 happened. One of those was, there was some funding from Prop 63, some MHSA funds. And Each Mind Matters has been just a great resource and a place to go to there at suicideispreventable.org. And that's been a statewide campaign to really equip from students all the way to adults and to those in later stages of life, as well as to recognizing the signs of mental health challenges and how to best link those to immediate supports if there's an issue of safety. Additionally, NAMI on campus, or National Alliance on Mental Illness, NAMI on campus clubs, and those are peer-led clubs on school campuses across the state, that their main goal is to reduce stigma and to make it easier to have some of these sometimes challenging mental health conversations. Those are a couple of initiatives that have happened, and I believe there was some recent legislation, Marlon, I think we had discussed earlier on student mental health and some of the importance on that we are seeing that is helping to decrease some of that stigma and helping to normalize the fact that, hey, I'm struggling. The lack of connecting with even my teachers or even my peers is really affecting my mental health. But Marlon, I think you had something from earlier.
Yeah, just add it. That's a good point. We saw some an exciting resolution out of Assemblymember Lowe's office, near the Silicon Valley, that would create a resolution that would declare a student mental health week between May 4th and May 8th each year. And I think that that would help too. Students are very on board. I think students, as you go down in the generations, I see less and less stigma. I think we are seeing that. So that's a really good thing. Everybody's struggling. And now with something that's literally affecting everyone in the world, I think we're going to see even less stigma related to saying, hey, I need help with this. This is upsetting, and it should be, and it's upsetting for everybody. So I think it'd be more clear to reach out. That legislation, though, I think is promising.
You know, and I would just add that there are these wonderful programs in schools, and I think we were all shaking our heads. Yes, our generations of students are much more open to addressing mental health issues and talking about them. But I think what it speaks to is really for those of us that aren't in K-12 schools any longer, we need to be doing a better job to talk about mental health issues that we're facing with our children, within our families. You know, if I asked us to raise our hands if we had a family member within a generation with a mental health issue, we would all raise our hands. These issues are in all of our families, and what's incumbent is upon us to talk about them as adults, to share the experiences of our families with our students, and that will allow our students to feel more comfortable talking with us, because often we see young people that want services that don't feel like they can do it because their families wouldn't understand, or they can't share it with their families. So I think our students are there. The issue is how we get there. And we have a lot of work to do to make these more comfortable conversations for ourselves so our children can feel more comfortable sharing them with us.
I think that's a great point and a perfect place to conclude on, which is that student mental health is not just or even primarily about the students. It's a community project, and we all have something to contribute to the discussion in making sure that these issues are relatable and that it's destigmatized and that it's prioritized in our discussions. So thank you to our panelists for bringing this issue to light. It's an ongoing conversation, and I'm sure we'll revisit, but that's all that we have time for today. So if you could advance the slide. We will post this, the recording of this webinar tomorrow or by Friday. That's Friday, May 22nd. You will be able to find the PowerPoint deck that was used in the presentation, as well as a recording of the webinar itself in the right-hand margin of our COVID webpage at csba.org/coronavirus. That's csba.org/coronavirus. And there's also a wealth of information, tools, and resources related to other aspects of COVID-19. So we encourage you to visit there. Next slide, please. And if you have any questions, please don't hesitate to email us at our general mailbox, csba@csba.org. We will get back to you quickly. And if you have a question for one of our panelists, we will try and direct it to them. Thank you for joining us today. We know it's a hectic time with everyone responding to COVID and the disruption to their personal and professional lives. And we appreciate you carving out some time for us. We hope to see you again soon. Goodbye, everyone.
Thank you.
Thank you
Very much.